Good morning, everyone, and thank you for joining us this morning for our next installment of Bringing the Protective Factors to Life. Given these uncertain times, we know that you've got a lot to do with your time right now, so we really appreciate you making the time to join us. We know there's also a hunger for information and sharing ways that we can all support each other and support parents in our state as they also struggle with the issues that we're currently facing. Thank you for taking time to tune in today, or if you're listening to the recording, thank you as well. My name is Chris Lawley. I'm the Executive Director of Prevent Child Abuse Florida and your humble host for today's webinar on social norms. You know, over the years, I've been privileged to work in the field of child welfare for more than 30 years now. I spent most of my time in what I refer to as intervention land. First started my career as a protective investigator here in Tallahassee and the surrounding areas. And it would never fail that when more than two of us got together, we found that the conversation always turned to, boy, we should really do something to stop this from happening before it starts. Little did I realize that years later, I would have an opportunity to do just that. That is to live in prevention land for a while and pay attention to prevention. During my time with Healthy Families, I was introduced to the Florida chapter of Prevent Child Abuse America, located here at the Ounce of Prevention Fund. So when the opportunity arose for me to do this work, I jumped at the chance. It's my pleasure now to help promote programs, services, and activities that support parents in their efforts and to help stop abuse before it starts. Of course, our role, as I said, is to focus on prevention, more specifically primary prevention. So it's our hope that by sharing the information on these webinars, we might be able to shed some light on exactly what it is that we can do to prevent child abuse and neglect. And hopefully some of you will garner information that'll help you replicate some of these efforts, or at least be able to get more information to have conversations about. So, what are social norms? Have you ever heard the question, if everyone went and jumped off the bridge, would you go too? I think most of our parents or caregivers have probably asked us that question at some point. Well, maybe you, like I thought, well, yeah, if everybody's jumping off the bridge, that probably means it's fun. Or there's got to be a swimming hole down there, and that sounds like even more fun. But what if I told you, though, that it was possible that you only thought everybody else was jumping off the bridge? And then, in fact, nobody really was jumping off the bridge at all, because that's how you can get hurt, and sometimes bad. What I'm trying to say is sometimes our beliefs, our perceptions are incorrect. Sometimes they're just flat out wrong. Or let me give you one more analogy. What if you're driving on the interstate? You know the speed limit in most areas is 70, but I'll ask you a question to ponder. What is the norm for how fast people drive? Some of us may think that people actually drive much faster than the speed limit, but could we be wrong? Social norms theory tells us that people tend to do or believe what they think most other people do or believe. So we can be comforted by the thought that our behavior then is justified because, well, everybody else is doing it. Maybe we should examine our perceptions. Maybe we've been wrong all along. So this is the basis for this work. And to bring slightly more intelligent thought to this premise, I'm honored to have two true friends and colleagues with me today, as I call them the dynamic duo. First, Ms. Katie Dively is a research scientist and senior trainer at the Center for Health and Safety Culture at Montana State University. In her role, Katie provides guidance to communities and organizations using what is called the Positive Culture Framework. Katie serves as the center's primary trainer and provides resources, technical assistance, and training related to evidence-based prevention. Let me say that again, related to evidence-based prevention practices, including program planning, capacity building, assessment, implementation, and also evaluation. Katie works remotely from her home, as I mentioned earlier, if you were on with us, way up yonder in Wisconsin. And in her spare time, which judging from her work schedule seems very limited, she enjoys traveling and spending time with friends and with her husband, Tim. Next, Miss Kathy Southern. Kathy's the Director of Education and Community Relations at Heartland for Children. Heartland is the community-based care agency in Circuit 10, for those of you who may not know. That's Polk, Hardy, and Highlands counties, down south of Orlando, near Lakeland and the surrounding area. Kathy also leads a fantastic prevention team at Heartland where, among her other duties, she's been working to implement the positive culture framework in their communities for several years now. Kathy has a daughter who I believe is about to start college, and she's also one of the hardest working people I know. So without any further ado, I turn it over to Katie. Katie?
Well, great. Thanks, Chris, for that great introduction. There's not much more left for me to say about myself. I've been at the Center for Health and Safety Culture for about 11 years. And like you said, I do work remotely. I travel a lot when we're able to travel. I travel a lot to give trainings and update folks on research and apply that research into practice. We're an organization that studies behavior and how, what can we do to improve, to create protective behaviors, protective beliefs that lead to behaviors to improve health and safety. And that research is only so good if we can't translate that into practice, which is where my role as a trainer and a guide comes in. And in that role is how I met Kathy from Heartland for Children. And we've known each other for and worked together for probably about 10 years. So it's really cool to be with you today to be able to share some of the background foundational work in terms of behavior and perceptions and social norms, as Chris mentioned, and then really see how it applies and how Heartland for Children has been applying the framework. Kathy, is there anything else you wanted to say to introduce yourself before we move on?
Well, I think just to give some context, I've been in the social service field for over 25 years, and 15 of those particularly in child abuse prevention work here in Circuit 10. And so I know a lot of our community partners are on the call today, and I'm thrilled that they're joining us. This work has been really transformative for our community, and we are thrilled to share it with you today. And yes, I will also say my daughter started at the University of Florida, my alma mater, so I have to give a little go Gators. And then yeah, we're ready to start.
That was a really little one. I'm not used to it. All right, Chris, if you can advance probably 2 slides to the tech tips. Perfect. Okay, so just to get us all acquainted with a little bit of technology here before we get started. As you know, you're all on mute, and that's really to preserve the audio quality for all of us. So you will hear Kathy and I present, but we won't be hearing that background from your screen. On the right-hand side of your screen, you should see a toolbar. Within that toolbar are a couple of things that you might want to take a look at. There's an area for questions. So if you do have questions, please do enter those in. We'll be looking at those throughout. We'll also have a dedicated time within the webinar to answer those questions. So we will be watching those. There's also an area for audio. So if some reason you get dropped or you can't hear us for some reason, you can certainly, there's a couple of different tricks in that audio section. There's a drop down there to give you a couple of ideas of reconnecting. You can also always call in. That sometimes is a little bit more clear if you're having trouble with that audio. Another thing is that we are going to be doing some polling. So we're going to ask you a couple of questions and we'd love your feedback there. Those will pop right up on your screen so you can just, put in your best guess, and then we'll tally those and get that information out to all of you so you can see how everyone responded. So please do contribute to those. With that, Chris, why don't we go to that agenda slide? We can give you a little bit of a heads up about what we're going to talk about today. So to start, we're going to talk about the frame that we use in our work to reduce child maltreatment. And the work in prevention can take a variety of different frames or a variety of different approaches. But today we're going to look at one that helps us be more effective in our work. Next, we're going to talk about, behavior change. Ultimately, the work that you're doing to reduce child maltreatment is all about changing behavior. So we want to look at the science here. Looking at the research is really important. Next, we're going to talk about the impact of beliefs on behaviors. So Chris mentioned this, right? We have normative beliefs that guide our behaviors, and misperceptions exist, and they definitely matter. So we'll want to take a look at that. And finally, we're going to be sharing the work that Heartland for Children has been doing to correct misperceptions and grow safe, stable, nurturing relationships for children. So on the next slide, I'd love to start here with this question, and to be thinking about this as we head into the presentation. We come to this work, all of us, no matter what our role is, we come to this work to be effective, right? We want to make a difference. We don't just want to be busy. We are busy, but we want to be, effective also. Otherwise, it seems to be a waste of our time and our resources and certainly our energy if we're not also being effective. So a goal of mine today is to really help us be more effective in the work. And on the next slide, so I'm going to ask you a couple of questions here. These are polling questions, and I'd appreciate your best guess. So you might not know the answer, and that's perfectly fine. Just give your best guess. And I'm intentionally selecting 2 questions that are probably outside of or that are outside of the field of child maltreatment, certainly, and perhaps outside of your field entirely. Sometimes it's nice to step outside what your areas of expertise are and review other areas of health and safety just for a bit of perspective. So if you wouldn't mind opening up the first poll for folks. Perfect. Okay, so here's the first poll. How has drinking among U.S. 12th graders changed in about the last 30 years? So these are high school seniors, right? How has drinking changed in the last 30 years? So give your best guess there. And now you might not think that this, doesn't apply to the work that you're doing, but in fact, it actually does. We know that youth who start drinking at a young age are up to 5 times more likely to develop alcohol use disorders, and we certainly know the impacts of alcohol on child maltreatment. So how are we doing with that poll? We'll give you another few seconds to respond. Give your best guess. All right, let's close that poll and see what we all thought. All right, so about half people thinking it's increased significantly over the last 30 years or so, and another quarter, so really about 75, over 75% of us thinking it's increased in some way. Chris, if you wouldn't mind popping up that next slide, where we can see the trend rate. Here, on this slide, this is interesting. So this might surprise us. That blue line is what we consider current use of alcohol or 30-day use of alcohol among 12th graders. And we can see that that's reduced significantly in the past 30 years. We would say in public health standards, this is a significant reduction. In the red line, then I didn't ask you specifically about binge drinking, but that red line represents binge drinking, which is 5 or more drinks for men or 4 or more drinks for women in the last 30 days. And this is also a significant reduction over time. Now, while these are incredible improvements and it's important for us to see where that trend is going, we definitely have work to do, right? I mean, none of us want 30% of our high school seniors drinking alcohol. However, it's really important to know that we're headed in the right direction and that the prevention efforts across the country are absolutely working. So let's pop up the second polling question. Okay, so the second poll is how has the rate of violent victimizations among women changed in the last 20 years? So let's give your best guess there. Again, perhaps something a little bit outside your field, but certainly something that we hear about and that we see quite a bit about. All right, I'll give you a couple more seconds to give your best guess. All right, let's close that poll. Okay, similarly here, the majority of the group thinking it has increased over time. Yeah, and a variety of answers there. Good. Let's go to that next slide, Chris. There we go. So again, this is interesting and something that might surprise us. So now just to give you a little bit of background on this data here. Now this is self-report data from a 6-month look back window. And the individuals that were recruited for this were recruited over a period of time. And these were phone interviews that were, it's a very expensive and a very complex protocol to collect the information that they collected. This is not police report data. So this is their own self-report, regardless of whether or not they filed a police report. So we see a reduction here too, and this might be surprising, because we hear so much about this on the news and in other sources, but, perhaps that means that there's more reporting out there, but I think it's also important for us to understand where we're trending in terms of that behavior. So if you don't mind, we'll pass the slides over to me here. Bear with me for just one moment. All right, what do you see? Can somebody chime in? Do you see just the slide?
We see just the
slide.
I'm sorry?
Go ahead.
We see the slide and you.
And me. All right. Well, you can choose to continue to see me, or we can turn off the camera, whatever is preferred. Okay. So we can see, give me just a second here. I have some pop-ups from GoToMeeting on my screen that I'm trying to remove. Okay. All right. So a question to ponder. So as we started to see that trending information, I'd like you to take a minute to think about how things are going. Think about this, ask yourself this question. Do you think it matters to your work, let's say, how you think things are going? For example, if you thought things were pretty bad and only getting worse, would that impact your work? I ask this to groups of people all the time. We give a lot of trainings, and I ask this to groups that we're working with, does it matter how you think things are going? And the audience always says, yeah, it does matter. It definitely impacts what we do, and how we feel about our work. It could impact our motivation for the work, our energy to continue to do the work that we do. It could impact how we engage with our colleagues or even our clients over time. So this is an important thing for us to understand. How we think things are going absolutely plays a role in how we do our work. Albert Einstein was once asked, what's the most important question to consider? Being the great thinker that he was, somebody asked him, what do you think is the most important question to consider? And this was his response. Is the universe a friendly place? He felt that how we chose to answer this question had profound impact on how we lived our lives. If we felt that the world was a negative, ugly, greedy, dark place, that led us down a certain path in our lives and it guided our behaviors. Now, if we felt the world was a hopeful, positive, friendly place, we had a very different path and a very different set of behaviors. And that brings me to the core assumption of the work that we do at the Center for Health and Safety Culture. We believe that the positive exists and that it's worth growing. that it exists in ourselves and our colleagues and in our clients, and that it's our work to uncover that, to measure that, and then to grow that. And this is an intentional focus on what's working, shining a light on what's working and growing that over time, rather than only focusing in on what's not working. And there's a lot of research to support this type of approach, right? Research would tell us that we move in the direction of what we study. So we want to study what's working, right? Now, that doesn't mean that we're not addressing the negative that's taking place. We absolutely are, but we're working to discover what is working and what is positive and protective in our culture and seek to improve or grow that. And this is about hope. And I like this definition of hope. And yes, there is a definition of hope. It's not just some happy-go-lucky feeling. This is something that's studied and researched quite a bit. Here in this definition, it says that it's the perceived capability to derive pathways to desired goals and motivate oneself via agency thinking to use those pathways. And we really see it as twofold, that there's this need to have a willingness or motivation to move forward, the will. But you also need to see a path forward, or the way. So we can sometimes have, you maybe have felt this before, right? We can have that motivation or the will to move forward, that desire to move forward. But if we don't see that path forward, we can get stuck. And I think that's important for us in prevention. We can often provide that path forward for a lot of people who are motivated to change. Now I want to talk for a minute about our frame or our approach to the work. We can come at this work from a variety of different ways. One, there's a fear-based or scare tactic type of approach in our work. Or we could have a hope-based approach or frame around the work that we do. And for this presentation, I'm going to draw a very clear dichotomy between the two. Sometimes it's not all that clear, but today I'm going to try to make it very clear just so that we can see the difference. This here on the screen is an ad from the Montana Meth Project, and now this was a project that started in the state of Montana to reduce methamphetamine use, and then other states could subscribe and pay, and also run this campaign in their state. What it was a series of very violent negative media ads over the course of a year, hoping to build people's perception that methamphetamine was not only harmful, but highly addictive. And at the beginning of the campaign, actually the perception was already really high. People did in fact find it harmful and find it highly addictive. But sadly, this went down through the course of the campaign. And this was definitely not what they hoped for. They found that people who saw the ads were either afraid and missed the message entirely because of that fear, or they didn't believe what the people were saying because the meth users that they perhaps knew didn't act that way, or didn't look like the way that the media was portraying them. So the organizers lost credibility and the audience for future messaging, and that's a really big deal in our work. We certainly don't want to go down that path. One really interesting aspect of the project was also some evaluation that they did. Now, they engaged in a pre and post survey of parents across the state of Montana. They asked parents before the ads ran, if you found out that your child was using methamphetamine, who would you reach out to? And like many of us, right, overwhelmingly, people wanted to seek help for their child. They wanted to call their spouse, their doctor, their school, treatment providers, clergy, anybody that they could reach out to help support their family. Now, they asked that very same question, if you found out your child was using methamphetamine, who would you reach out to? At the end of the campaign, after those campaign ads had run. And parents, after seeing those ads, no longer wanted to admit that their child could be using meth. The ads had demonized these meth users or created monsters out of these meth users, and many parents didn't want to admit that this could possibly be their child. And this is not what we want. We want to build bridges. We want to find ways for people and families to access supportive services to get the help that they need. Fear appeals can have negative outcomes, unintended outcomes that make our work even harder. They can label and stigmatize certain groups. They can expand social gaps in our communities, and they can even promote poor health as something that we value, which we know it isn't. And I think something that's really important from the research too is that fear appeals or scare tactics can elicit an immediate reaction, right? We've seen this before. They can make people say, oh my gosh, I'm never going to do that. But research says that that feeling is very short-lived, right? We've all experienced when, like Chris was talking about speeding earlier in the introduction, it's like we've all experienced going down the highway, we see law enforcement on the side of the road, we slow down, a mile later we start to speed up again. You know, this is pretty consistent for us. You know, we tend to go back to our regular ways after we see that message. Some practitioners might think, ooh, well then maybe we have to up the ante. We have to scare them more the next time so that we keep them engaged or engage them again. But this can have even more unintended outcomes. We can lose our audience entirely if they become too scared to stick around for that message. Or we become less credible because what they're seeing in the ads would, very likely never happen or rarely happens. So to be effective, to create that long-lasting change, we really want to create messaging that drives people in a direction of health and safety, in a direction that can be sustained long-term. Humiliation, shame, guilt, and angst are not the primary engines of change. Ironically, these experiences can immobilize a person, making change even more remote. Again, making our work harder, and I think our work is hard enough. We don't want to make it harder. But it does beg the question here. Is there a difference between raising concern about the issue and creating fear? And I would say yes, there is a difference. We want to raise concern. When people are concerned, they pay attention. They're motivated to act, to learn more, and to engage with us. However, when we instill fear, people want to run in the other direction. They shut down or push back. Our role is to raise concern, to engage people, to help them understand the concerns about child maltreatment. And we can do that in a way that doesn't create fear, shame, stigma, angst, and therefore make change even more remote. To motivate change, we want to raise concern and hope. We can create a sense of concern so that people are motivated to change, to act, and then we create hope so that they can see that path forward. And both are necessary for our work. Hope is about growing safe, stable, and nurturing relationships. Everyone can contribute to this, not just parents, but communities too. And this broad opportunity to grow safe, stable, nurturing relationships, and for policymakers to create environments to grow safe, stable, nurturing relationships is a huge shift. The CDC's Essential for Childhood document reflects this. If you haven't seen that document or that report, get it, find that. It's a shift to promotion. It's a shift to growing protective factors. It's about what we can grow to reduce the impacts of child maltreatment and prevent it. The work that we do to grow safe, stable, nurturing relationships is all about behavior change. And it's not just about behavior change among parents or caregivers, right? It's about many individuals in the system. It's about, of course, about parents and caregivers, but it's about healthcare and law enforcement, child protection agencies, key leaders. So there's a lot of behaviors here that we want to look to shift. And if we're talking about our work being about changing behavior, then let's look at the science to tell us what's driving behavior in the first place. So this is an extremely simplified version of a behavior model that you can see on your screen. There's more to it than this, but this gets us started. So if we start at the very right-hand side of that arrow and we see behavior, this is intentional behavior. I want to be clear on that. There's a lot of behaviors, but this is the behaviors that we choose, not like reflexive behavior, right? When the doctor hits your knee and your leg jumps up. No, that's reflexive behavior. That's not this. And this also is not behaviors associated with addiction. These are behaviors that we choose. So we know from lots of research that willingness and intention predicts behavior. And we can measure willingness and intention. Okay, so what is predicting our willingness and intention, right? So if we're willing to engage in a behavior, or if we have intention, like we make plans, we're more likely to engage in that behavior. But what's driving that? Well, that's our attitudes and our beliefs about the behavior. And we can have favorable or unfavorable attitudes and beliefs about the behavior, right? So then that begs the question, let's back up a step, right? Well, what's driving our attitudes and our beliefs about that behavior? Well, that's our value system. And in general, values are pretty independent of the behavior. So it's not like I have a value system around wearing a bicycle helmet. I might have beliefs about a bicycle helmet, but I don't have a value system there. Our value systems are more broad in nature. They're maybe more around health or safety or protection in general. And they're slow and they're difficult to change. We can, however, in prevention, have a pretty big impact on attitudes and beliefs. These are quicker to change, and they're definitely associated with certain behaviors. So this becomes a huge opportunity for us. We can start to leverage and start to work to shift attitudes and beliefs to drive willingness and intention to engage in certain behaviors. So this is the behavior model that we use at the center. This is where all of our work stems from, and it's fun for us to study these different areas of these different boxes that predict behavior. But the only reason really that I want to share with you this larger model is that you can see that it's a variety of beliefs here in green that predict willingness and intention. So to start here, we have behavioral beliefs, and behavioral beliefs are what we expect to happen if we engage in a behavior, what we expect the anticipated outcome is. Then we have normative beliefs, what we think is typical, what we think everyone is doing, or what's expected of us. And then that third box is control beliefs, and this is the knowledge or skills required to engage or not engage in that behavior. But also important to control beliefs are whether or not we're comfortable engaging in that behavior. So today we're going to focus our conversation predominantly around normative beliefs in that box in the middle. But it's important to know that these other different beliefs also exist and contribute to behavior. So let's talk about normative theories for a bit. Chris introduced us to this right at the start. Let's give a couple of definitions here. So let's define a norm. A norm is the actual norm, is the actual behavior or belief of the majority. It's what most people do or what most people believe. A norm is actually anything over 50%, right? The majority. And we can learn what the actual norm is by asking people questions. So for example, how often do you smoke? Can help us understand the norms around smoking behavior. Now, the perceived norm is what we think most other people are doing or believing. It's what we think most other people are doing or believing. And we can also gather this information. We can better understand what the perceived norms are. We could ask, how often do most students in your school smoke, right? You're asking them what they believe most are doing. And what we find is that there's often a gap between the two. We misperceive norms in our environments all the time. And this is really, really important. And to echo what Chris said earlier, we tend to do or believe what we think most people are doing and believing. But we're often wrong. So if we think most people drink, we tend to be more likely to drink. If we think most parents do not ask for help, then we're less likely to ask for help. We tend to overestimate risk behaviors, and yet we tend to underestimate protective behaviors of others, like getting help, like wearing a seatbelt, like wearing a helmet. And this is important for us because this is driving our behaviors, right? These are beliefs, very important beliefs that are predictive of behaviors. So then our work becomes apparent. We need to be working to reflect the actual norms, those normative beliefs that are prevalent in our communities and among our audience members to correct these misperceptions and motivate change. So Kathy, I'm going to turn it over to you now, and you're going to describe a little bit about what you guys have been doing at Heartland for Children.
Yes. Thank you. I'm going to need a minute to pull up and get this the right way. Okay. All right. I am going to, oh. Okay, we're ready. First thing that I wanted to share with you all is that as we embarked on this journey and we were first exposed to this, one of the things we realized quickly is that the messaging surrounding child maltreatment really had a negative frame. We were seeing it everywhere. As soon as we became aware, we just saw it everywhere. And we started taking pictures of billboards and looking at messages that came along. And, then we started to say, well, really, we need to really assess what those parenting norms are in our own community. And so we worked with the staff at the Center for Health and Safety Culture to create a survey that went out to parents that reside in our Tri-County area of Hardy, Highlands, and Polk counties. So we actually sent out 4,600 surveys and 733 responded. I know when I share this information, some people are like, that's really not a great response rate, but it really is, because you can see that with a confidence interval plus or minus 4 at 95%, we can really feel confident in the information that we obtained. And, we want to really give you some specifics today about what we found. And so, okay. One of the things that came out right off the bat is that we have really strong value. Parents in our community have really strong values about their children. And so I will not read all of these to you, but looking at these norms, 90% and above of parents really agreeing those are incredibly strong norms. We also looked at, wow, our parents in our community have strong protective beliefs about safety and avoiding harm. Nurturing beliefs as well. So you can see through all of these particular norms that we found, the commonality is that they're really strong, positive parenting behavior in our community. Particularly this last one I thought was interesting. I believe parents need to have ongoing and open conversations with teenagers. That one was a great one to see. And then as we continue to do this work, well, that's our norms, but one of the things we did as well is we asked that question, what is the norm and then what's the perceived norm? So we really needed to ask parents their perception about norms in the community, right? What are other parents doing or believing? And so we realized that there were significant misperceptions in our community, and understanding that perception is everything. I love this picture on this slide. What we believe to be real is real for us, even if it isn't accurate. And so that's how we went into this work on misperceptions. And so we know that people live with a lot of wrong perceptions, ideas, and notions, and when they invest their lives in them, it's dangerous. It can be dangerous, as we've seen in the science behind beliefs influencing behaviors, and these misperceptions are beliefs. So what do they look like? Here's our positive, strong norm that we have in our community based on our survey. Most parents, in fact, 90% of them, strongly agree with this statement: I want to do what's best for my children. But what do parents think other parents, what's their perception about other parents? And then this other group we added in was professionals in our community, because the perception of professionals, so we're talking child protective investigators, we're talking protective services case managers, we're talking healthy families staff, children's legal services, other prevention providers in our community. That's who we surveyed when we looked at professionals. So when we looked at those misperceptions, 62% of the parents we surveyed did not think that most parents would strongly agree with this statement. That is really concerning to us, as well as this 73% of service providers. So these misperceptions exist, and this is really a critical piece to the work that we're doing. Here's some additional ones. I want to be stable and positive influence in my child's life, but we had 61% of those parents not thinking that their perception was that parents would not say that, as well as 69% of service providers. Parents need to have open and ongoing conversations with teens. I mentioned this one specifically. That was a 90% norm. But what did they think? Wow, 70% of those parents did not think parents would believe this or state this, as well as 84% of those service providers in our area. So this really gets our brain starting to think, what does this mean for the work that we're doing, and what do we need to do to, correct these misperceptions? Here's one last misperception that we'll share with you. And this is on shaken baby, right? So that norm is actually 90%. But we had 64% of those parents and 68% of the service providers not believing that this was the norm. So they had a strong misperception here as well. Misperceptions really matter. And as we look at this slide, we need to think about, they really influence our behavior. So these are some findings from other projects that Katie and their crew at the Center for Health and Safety Culture have engaged in. They found this based on calculating risk ratios of the data. So we know that students who misperceived monthly drinking among their peers were actually 6 times more likely to drink monthly and 9 times more likely to binge drink. When we look at adults who perceived that most wear their seatbelts less than half the time, they were 9 times more likely to wear their seatbelts less than half the time. So we can see this critical impact or influence of misperceptions on behavior. Adults who perceive that most are speeding half the time or more were 10 times more likely to speed half the time or more. We need to think about what this looks like in the work that we do in child maltreatment and think, what can we do about this? What is it that we can do about these misperceptions? And of course, we really want to talk about a prevention program, and that's what we're talking about now, an intentional experience designed to change beliefs. We looked at this behavior model already with, oh, there it is. It's taken a while for that slide to come up earlier, but we know how influential beliefs are, and we've got to be thinking about our prevention programs as a way to shift those beliefs. So intentional experiences can come in many forms. They can be through curricula, presentations, conversations, communication campaigns. We're going to share how we at Heartland for Children are engaging in a communication campaign to help shift these misperceptions in our area. Oh. All right, guys, let's see. Okay, so we know that alone media campaigns can rarely change beliefs. Those successful campaigns really are grounded in that good theory, but they require a high dosage really to be effective. And so many campaigns won't work because of these factors. We don't want to engage in a campaign of telling people what we think they need to hear. It really needs to be grounded in good research and science, and really looking at obtaining that correct dosage. Okay, taking us back to the simplified behavior model, just to keep this at the forefront, we're really looking at shifting those normative beliefs to change behavior in our circuit, using this normative theory as the background. And Katie mentioned earlier, the Center for Disease Control has the Essentials for Childhood that is really important to take a peek at when we look at this work. So this is really taken from one of those resources through their work. And when we talk about promoting positive norms, this is really more than just focusing on those actual norms. It has to include the correction of that misperception of norms. And so we know that we get a positive momentum, momentum for that positive change really grows when we have more people in our community that are recognizing that the norms around them can support that change. So we had to reflect a little bit when we talk about child abuse prevention. Obviously, this could cover a plethora of behaviors. Those of us who are working in the field know that we have major societal issues that impact child maltreatment, substance misuse, and domestic violence, and stress and lack of resources. And we could go in a number of ways with this. And so we really wanted to think about what are those behaviors specifically that we are trying to change. And so what we end up with is these are those parenting norms that we really want to look at. So protective behaviors, nurturing behaviors, seeking and receiving help, and parenting skills. That is what we want to grow. And so when we think about our campaign, that's that critical, piece of understanding those behaviors that we want to grow. When we first started rolling out our messaging and this information, we had a lot of people who really misunderstood the concept, and they really thought, oh, here comes Kathy, Pollyanna, or, just it's all positive. And as Katie mentioned earlier, it really, this isn't about minimizing a very serious problem, because we know child maltreatment is a serious problem, but it really is about promoting hope from a strength-based orientation. And so I think when I think about this particular slide, I keep hearing Katie in my mind and really continuing to tell us that we want to promote what we want to see. So these campaigns that are promoting, bruised and battered children, we can understand why that might not work. Or, the meth campaign that you saw. We want to really promote what we want to see. And so through a combination of concern and hope, communities can really grow safe, stable, and nurturing relationships. But creating that context of positive norms really matters, because it establishes that expectation and acceptance of those healthy attitudes, behaviors that we really want to grow. So when we think about growing concern and hope, the work really becomes about developing a communication effort that intentionally is sought to raise concern and hope about child maltreatment. We used the center's 7-step communication process. And so we could do a whole session just on this, right? But we're not going to do that. We just really want you to take a peek at this, because this is the model that we used for the work that we're doing. This wasn't, Kathy taking surveys that she just tabulated, in her office. This wasn't, just one team of individuals saying this is what we think and we're going to put that out there as far as the messages. There really is a process for this. We're looking at baseline data. We're testing our messages before they go out. We're altering them if they're not really hitting the core that we're wanting it to hit. And so as we go into that and we went into this work, we really had to take the time to reflect on where we were, what did we learn from the survey, and we started to have hard conversations about our own misperceptions. If my perception is that most parents don't want to do what's best for their kids, what am I bringing to the table to that parent that I'm working with? What am I bringing to that staff that I supervise in the work that I do? How am I bringing hope? And these were some hard conversations we started to have. When we use a negative frame in our work, and I'm sure many of you have seen that, I personally believe a lot of that has to do with the stress that accompanies this difficult work. and burnout often sometimes that you may feel. But there's a lot of negative framing, and we had to really think about these things. What belief am I trying to change? Are we really bringing this message of hope? And how can this positive frame really impact and add to my efforts in the work that we're doing? And so we really had to start by increasing the awareness of this particular information, right? The impact of a negative frame on the work you're going to do, how using a positive frame can change that. Really doing a lot of practice in the work that we do to reframe messages. We saw this time and time again. We got a lot of practice in reframing messages. We have done training for our partner agency staff, and we obviously started to roll out our campaign. But the work we've done isn't just to put out signs and posters and messages. There has been a lot more work there, and a lot of this work happens in conversations, which is why you see an asterisk on this particular slide, because we really embrace this concept of words create worlds, right? So our words matter. The words that we use are really critical in our conversations with each other, with parents, with foster parents, with children, and with our colleagues, and particularly those parents that we're working with. And really coming to this commitment of hearing and steering conversations, because it's not just about the posters and the media that you see. It's about what you hear and how you can positively steer that in a positive framed direction. And so we also really have to continually reassess the work we're doing and who are our new partners that we need to bring on, and are we getting that effective dosage of the messaging and information. So we're going to start to share with you some of our some of the images and messages that we've created. And so we're starting with this one. This was really one that we tested early on. We wanted to come up with an overarching theme that connected all of those values in our community. We looked at mission, vision, and values from over 200 agencies within our Tri-County area and started to come up with those commonalities, and ended up with this message, which really sort of reflected what we feel in our community, a community that cares. And we believe that wholeheartedly. This was one of our early messages that went out, and as I mentioned, we didn't just create this ourselves. Obviously, we have a group of folks that are inputting, but we test this out. We test it out in our child abuse prevention work groups with our staff and other people, other parents, to say, are they getting the message? We let them see it for a few seconds, and if they can't recall it, were we really effective? Was that really an effective message? So this was one of the really great ones that we came up with earlier, and you can see that overarching message sort of tied in between. The other piece I want to point out is that we want to make sure that they understand where this data is coming from, that this is it's a credible source, and there's somewhere they can go to obtain more information. Here's another message that we went through. So they want to be a stable and positive influence in their child's life. And through these messages and the appropriate dosage, our goal has really been to correct misperceptions and build upon those positive norms that exist. This is one of my personal favorites. And this particular one aligns so well with the Pinwheels for Prevention campaign and those parenting books that come out, right? So when we looked at those yard signs in our areas, one of the things we did is we put on this on one side, and then we had the Pinwheels for Prevention message on the other. And so we are constantly looking for ways to get this message in front of parents and in front of professionals, right? Because where do those misperceptions lie? It's not just with the parents, but it's also with us as professionals in this industry. And so really, when we think about the work that we've done, we look at this as transformative work. We really want to embrace this concept of how we communicate matters, our words matter. We have been reframing messages across the board. We often have our partners seeking guidance on how to do that in their own fields. We have other agencies in our community, particularly our substance abuse prevention providers, that are also embracing this work and doing amazing things in our high schools with substance abuse prevention. And so collectively, we're feeling this sort of shift, and we have other agencies starting to adopt these practices. So we're at the point right now where we really are preparing to go back and do another survey to really see how effective we've been in correcting those misperceptions and how much we've built upon those norms. But because we don't have that survey yet doesn't mean we can't really see some of the evidence of the larger impact that this work has had on our community and the people in it. And so we've seen a shift in our social media presence and that of others. A lot of this reframing from this positive frame. And I just want to mention too that this work really takes time. As Katie mentioned, we've been working together on this for 10 years. And this is shifting perceptions and beliefs and practices is work that really takes time. But there can be some immediate changes just in being more aware of how we frame our messages to the people we work with and the people we work for. And with that, Katie, I'm going to shift it back to you. You're going to grab that screen or?
Perfect. I think the screen may be given to me. Yeah, okay. Give me just a second. Alrighty, can we see Kathy, the framework slide?
Yes, I can see it. Mm-hmm.
Perfect. Okay, so I want to thanks Kathy for that feedback. I think it's really important to understand, yes, what the kind of what the foundations look like, but then how that's applied at the local level, and the amount of effort that it really takes to be effective. And I just so love working with Heartland for Children because they really are embracing that idea of being effective rather than just busy. And Kathy mentioned, campaigns can be ineffective. We can throw up messages that we think the community needs to hear. The community needs to know that, it's harmful to shake your baby, or, most often they know that already. It's something else. It's some other belief that we need to be shifting in order to change those behaviors, to grow those safe, stable, nurturing relationships and those behaviors associated with that. So I love their attention to being more effective. And the reason I show this positive culture framework slide is that this is the framework that we use at the center to improve health and safety. And communities use this framework for a variety of different topic areas. In this case, obviously, child maltreatment. Lots of cases that we're working with are, lots of communities and organizations that we're working with are seeking to reduce substance use or improve traffic safety in some way, ending violence. So there's so much that can be brought into this framework, but I at least wanted to show you it as a way to organize the work to improve health and safety. It's very much from a hope-based frame. It's an appreciative model. You can see that on the right-hand side of your screen here. It's an upward pointing green arrow. We're seeking to improve health and safety. There's a 7-step process outlined in blue here that is really, the what we do in terms of the work. There are 3 key skills here that help us be more effective, and that's prevention leadership. This is an active leadership. We're leading people towards healthier and safer behaviors. It's all about communication. There's no one strategy that we can engage in any prevention topic area that doesn't involve some sort of communication. So honing our communication skills, that ability to balance or to raise concern and hope is critical. And then the integration of prevention strategies, right? We all know that there's no one strategy that's going to effectively reduce child maltreatment or, effectively reduce underage drinking or eliminate speeding. It is a variety of different prevention strategies, and integration of those strategies and how they align with one another is critically important. And then in the middle of this is the context for doing the work. It's across the social ecology, or those different layers of social environments that we live within. All of these environments influence our behavior, so it's important that we're working across the social ecology to be effective at changing individuals' behaviors. So for example, if parents are our focus audience, and that would be individuals in this case, You know, they're influenced by their peers and by their family, and they're influenced by the organizations that they work for or that they belong to. And absolutely, the community's norms and policies and how those policies are enforced impact their beliefs and behaviors. That's why it's important as we go through these 7 steps of our process to improve health and safety, we're thinking along this context of the social ecology so that we're taking a truly sustainable approach. So in our work, so obviously we use this framework in all of our work to improve health and safety. When Kathy showed you the 7-step communication process, that's a specific process that was used at Heartland for Children to clarify misperceptions and apply social norms theory. So that's a critical skill here of communication. In other projects that we've done at the center, we have done projects for many, many years to shift beliefs in order to improve health and safety. A couple that we're working on right now, just to share with you. Let's see, the first one here being a project that we're working on with the Utah Department of Public Safety Highway Safety Office. They've experienced seatbelt use being lower in rural areas of the state rather than more urban areas of the state, and they really wanted to investigate why people in more rural counties were not wearing their seatbelts. So we started to engage with them about 8 years ago to try to grow protective beliefs and clarify misperceptions across these 7 counties across the social ecology, so many different audiences. And what we found, we've done pre and post tests over a number of years. What we found were statistically significant changes in seatbelt use rates across all 7 counties on only those beliefs that were communicated about. So that's pretty cool. We were able to, compare that to the other areas of the state that did not have any messaging. So those, that campaign that worked to grow protective beliefs that we saw from the surveys associated with certain behaviors like seatbelt use and engaging others to wear seatbelt use shifted as a result of that communication. And there's definitely more information on our website, and actually a webinar that we did on those results on our website as well if you wanted to pay attention to that. The Idaho Transportation Department was looking to prevent driving after drinking, and this particular work was looking to grow the intention to intervene. So if you remember that behavior model that we discussed, intention comes before the behavior. And we had a very short time period for this project. We know that actually being in a situation to intervene with somebody who's about to drink and drive doesn't happen all that often. So we felt that if we could grow somebody's intention to intervene, we could be successful. So so what we were able to do is we were able to run a short campaign, short being 1 year about, to increase protective beliefs. And we were able, it was very nice. We were able to have 3 intervention groups. We had 3 counties that were able to run the campaign, and then the rest of the state served as the control sites. And in those 3 counties, we were able to see statistically significant changes in each of those protective behaviors that we messaged about, as well as that intention to intervene. And there were no changes in the control sites that didn't have messaging. Finally, just to mention that there are many, many social norms projects out there. There's a lot of research on social norms in general, specifically around areas of substance use prevention among youth, high school, middle school populations. There's a lot of work out there. We do a lot of work at the center on social norms marketing with young people and I-assist communities in that work, and provide training on that as well. So that is definitely something that you could look to the research for to find more information if you are interested in evaluation efforts there. So in wrap up, what I'd like you to be thinking about, we'd like to leave you with a couple of questions to consider as you move forward. The first one is really to start to think about how you receive information. We get so much information from so many sources. So it's interesting to start to think of, how do we even receive information? Where are we getting it from? Is it a trustworthy source? How do I communicate about the issue? Am I very unintentionally creating misperceptions in my eagerness to get people engaged on the issue? And I tend to think, that we're so we're so passionate about the work that we do. Are we accidentally creating misperceptions in terms of prevalence of the issue, or even creating fear in our, eagerness to get people engaged? And then finally, what else do I need to learn? And I'd encourage you to look into using a hope-based or strength-based frame. Again, the research tells us that we move in the direction of what we study. So if we are only studying the problem, we may find the problem and what's contributing to the problem, but we're not necessarily going to find a solution to that problem. You can absolutely check out, and I'd encourage you to check out the CDC's Essentials for Childhood document if you haven't already. And then, of course, feel free to look at, I'll put up the website for my organization. If you want to learn more about the framework, you can watch a short video on it or webinars of our work. That's all free. You can certainly take a look at that. So with that, I'm going to ask what your questions are. And if you forgive me for just a second, I'm going to pull out the questions that you've already entered into the chat window or into the question panel. Please do ask any questions in there, because we're going to open that up and start to answer those. One that I see come in, which is so fascinating to me, Bernadette, you asked a question. I'm looking at the attitudes, or maybe it's just a comment, but looking at attitudes around people regarding COVID-19. And as you can imagine, that is fascinating for us, because we very much know that beliefs and attitudes are driving people's behaviors. So we wanted to know more about this at the center as well. So we have just received a grant to study people's beliefs around protective behaviors, like wearing a mask, like social distancing, for example, and how that's contributing to their behaviors around COVID-19. So we are just in the planning stages of that work. We just received this grant about 2 weeks ago. So we too are very interested in people's beliefs there, and are eager to get that project underway. Another comment that comes in says that my thoughts are that the person answering the question are doing so from their personal experience, and it's reflective in their answers. Absolutely. I mean, if this is referring to people's responses on surveys, absolutely. And we want people to be answering honestly from their own experience, without a doubt. We know also from the research that people who are involved in the behavior, this could be individuals that have are experiencing child maltreatment in their homes, right? If there is some sort of child maltreatment, this is people, if they're answering about their own substance use behavior, for example, if they're already associating with that behavior in some way, or their tight group around them, of their closest peers, are engaging in that particular behavior, they are going to have even greater misperceptions of what's going on with the majority of people. That makes sense, right? Because it's their reality. They're living in it, and they're experiencing it in their tight circles. So of course they misperceive the amount of the general public that's also engaging in that behavior. Any other questions that other folks are seeing, or any other comments from Kathy or other group members?
Katie, hey, this is Chris.
Hey, Chris.
Hey, I wanted to see if you and Kathy, or either of you, could talk a little bit about how you see this work is connected to the protective factors.
Happy to talk a little bit about that, Kathy, and then maybe you could kind of chime in specifically. I mean, I think just generally speaking, protective factors in nature are absolutely something that our organization is working to grow. We want to better understand first, what are those protective factors, what are those protective behaviors, what are the protective beliefs leading to those behaviors, and then seek to grow that over time. Kathy, did you want to talk specifically to any particular protective factors that you're addressing?
Well, I mean, yeah, I think that when we're looking at all of the protective factors, really, it's all that framework is from a strength-based lens. And the goal of that is to build, strong, healthy families. And so when you look at this work and the messaging that comes along with it, it aligns very well with all of those. In general, we're looking at trying to increase the self-help behavior. So we know that, seeking help and getting concrete support is really important. Social connections are important too. And so really thinking about what other parents are doing and how I'm connected to them as part of that parental community, increasing their knowledge. A lot of our messages are around, I can increase my parenting knowledge and techniques, and getting help is okay. Gaining more parental knowledge about parenting is okay too. So those messages align very well with building that skill development through protective factors, their knowledge of child development and the like, the parenting and child development.
Thank you.
I think it aligns.
Thank you, Kathy.
Well.
Katie. Yeah, I'm sorry, Kathy. I absolutely agree. And I just want to add, I think a lot of what this does to me is set the tone or help build the foundation for those positive attitudes, values, beliefs. And you do feel like, when you see that other people agree with you, or, hey, I'm not alone in this, and that can help build resilience in and of itself and establish those feelings, if nothing else, about it's okay. Everybody needs help every now and then. And it's okay for me to call on people when I do need help. And I'll take it one step further and say that I also think that it can help us to be able to know how to reach people. And in the public service announcement that we run as a part of the campaign, I know Kathy, and I know many of the people on the phone have seen it. If you haven't, it's available on our Facebook page and our web page as well at preventchildabusefl.org. But I think when we focus on what we want, like you were saying earlier, Kathy, when we see that public service announcement, we see a neighbor who sees her neighbor struggling with her kids and trying to get the groceries out of the car. And I think most of us who are parents can identify with those times when you just want to pull your hair out. So to me, that just sets the table for saying, oh yeah, I would be willing to help people. I think people would be willing to help me. So it establishes those attitudes and beliefs and feelings about I'm not by myself, I'm not alone. There are things that I can do to build my own protective factors, and I'm not by myself. So thank you. I know I put you on the spot. I just wanted to see what y'all's thoughts were.
Chris, I have a colleague that often says, and I love this, she says, the messages give us permission, right? So it's like you said, if you feel like, oh, there are other parents out there who also want to ask for help or are also looking for help, like it gives me permission to be able to ask for help too, or even to support my neighbors, right? Maybe I'm a neighbor and I know that there's a family that lives next to me. I may not have kids, but you know what? It gives me permission to say, you know what? We're in a community that cares. It gives me permission to care about my neighbors and this mom and whatever it might be. But I love that.
And with so many negative messages out there, and obviously, thank you, Kathy, that I know the work that y'all have done down there, and I know we have the contact information on the screen for both of you. But I just want to give a little bit of a plug through my comments here for you guys, Kathy, being willing to take this work on, number one, devoting so much time, energy, and frankly, money to be able to do this. It really, to me, goes above and beyond in being able to say, let's talk about what we want. Let's don't focus on what we don't want. There's plenty of those negative messages out there. And promoting what we want, I think, is exactly what we want to do with the campaign. So thank you again.
Well, you're welcome, Chris. And I think that that's what we've seen is that people want to, when you're speaking with a hopeful and positive frame, people want to come on board. They want to be a part of that. The negative frames really are often off-putting and intimidating, and stir up all kinds of emotions that folks aren't necessarily, it may drive them, as Katie mentioned, temporarily, but we're in this for the long haul, and we need to do work that's going to bring people along for the long haul.
I think people want to know they're not by themselves. They want to know that they're part of a community, and that, hey, this is in spite of everything that I see on a daily basis, because we all know what the news is full of. There are people in our community that are just like me, who would help their neighbor, who would ask for help. So I also want to take a minute. I forgot earlier to thank Brianna and Nydia for joining us today as part of our team and helping answer questions, especially the technical questions. So I just want to give a shout out to them. So thank you, Brianna and Nydia. And I want to give people just another minute to see if they have any final questions, and then any wrap up messages that y'all would like to give.
And Chris, a comment came in about whether or not the slides would be made available.
Okay.
And I believe you are sending a PDF of the slides. Is that accurate, or posting that, or how do you do that?
We can post those on our website. We sure can. Those folks who have been with us for other versions of our webinars know that we have set up a section of our web page that's devoted to this series of webinars, and we'll post those along with the recording on our website, and we'll share the recording on our Facebook page.
Great.
Brianna, Nydia, do we have any other questions?
We've been getting some great some comments just saying they absolutely love the emphasis on hope in messaging. It can be very powerful indeed. Had somebody else share, thank you so much, very vital information. I truly appreciate everyone, great job. And then somebody else just shared, Kathy said it, we want to promote what we want to see. Well said, thank you. And
Yes.
then, one thing I want to say is when I first heard this information as well, at first, Kathy approached me with some of our survey results, and I was like, wait, is that real? Like, are you sure? Like, most parents actually want to do, and, in this field, it's oftentimes you kind of catch yourself questioning, like, is this really the norm? And what I love is being able to recognize that most parents really want to do what's best for their kids, and recognizing the thoughts and the promoting, like they said, we want to promote what we want to see. So I've always learned so much from both of you guys, so appreciate it.
Yeah, Brianna, I'm so glad you brought that up. I was thinking along the same lines when Kathy was showing us the results, and I'm just really glad that y'all broadened it out, Kathy, to talk about staff and to talk about people who actually do the work with families. I think that says two things to us. Number one, unfortunately, we still have a lot of work to do. But number two, I think just as Brianna said, that can change our own thoughts and beliefs. And to me, I think there's a lot to be said about compassion fatigue and burnout, and there's plenty of people who are out there who are struggling today. I think even more now than ever with bucking themselves up, so to speak. So if you see some of those messages, you can say there is hope. There are things that we can do. I'm gonna go out there today and give it my absolute best to the families that I work with. So thank you again, Kathy, Katie. I just can't say enough about the work that y'all are doing, and I really want to thank y'all for the time today. And if no one else has any other comments, I'll leave it to Kathy and Katie to close us out.
I did see we just had one other comment that came in from Bernadette saying, I think sometimes the reason some parents don't reach their goal of doing the best for their children is more of a personal reason, not feeling confident enough in themselves, their knowledge of what is available, or how to tap into their resources.
Yeah, I think that's a great comment, Bernadette. And I think, part of that confidence thing is definitely a part of the belief model when we talk about their ability to understand what to do, their knowledge level there, but also their comfort level is huge when it comes to control beliefs. Totally agree with you there.
Kathy,
Well,
any closing thoughts?
Just
Go ahead, Kathy. Sorry.
Part of this webinar today, and of course, if there are any questions, please reach out to either one of us.
I just think in closing, I mentioned earlier, I think the work that we do is hard. And I think that when you're working with families that are struggling and they're really at a tough time in their journey, that it is easy to get sort of jaded and have a negative frame. And we have to just remind ourselves with the work that we're doing that most parents do want to do what's best for their kids. And it's really important for us to bring that to them, bring them the hope. And that's a huge part of the work. And then we need to help other parents realize that they can do it, and so I think it's, I love doing this work, and I love seeing people come along with it. And I'm absolutely available if anyone has questions or wants to ask any further information about how we've done it and what we've done. We're excited to continue it.
Well, thank you again, both. I think that Kathy just weighed in, Ms. Acevedo. I think I'm saying her last name right. Kathy, I hope you're still listening. She said, thank you for the paradigm shift. And I think I certainly agree with that comment. So I'll just close by again thanking everyone for joining us today. Thank you all so much. We'll have this recording up and available on our website, as I was saying earlier, and we'll have that. I'm sure we'll have it by the first of next week. So thank you again, everyone. We really appreciate you joining us today, and stay tuned. We'll have another webinar. I'll be making announcements really soon about the next couple that we'll be doing. I mentioned compassion fatigue. That's a real interest of mine and something I really want to talk more about. We'll also have a couple others that we'll be announcing very soon. So thank you both again. Thank you everyone for listening.